All right, everybody. Here we go with part 2 of an introduction to stuttering. Here's some great artwork by Daniel Rossi. Check out the stutteringiscool.com website. It's great. If you go to grad school at Appalachian State University, his book will be a required book in the grad fluency disorders course. All right, so really quickly, stuttering is not these things. So before we get into what stuttering is not the opposite of fluency, right? People who stutter, like myself, still have a lot of fluency, even if I was stuttering, a good deal. Someone who's a severe, quote unquote, severe stutterer is going to probably stutter on about 20% of their words, but that means that 80% of their words are fluent. So it's not the opposite of fluency. It's just something different, a different way to talk. Stuttering is not a language disorder. People who stutter know what they want to say, and they just have a hard time outputting that. So it's really, think of it a lot like a motor speech disorder where we know what we want to say, it's just not coming out. So it's not a language disorder. It's not a voice disorder. There's nothing physically problematic or wrong about the vocal folds of people who stutter per se. The difficulty is in how they're being used. So it's not a voice disorder. And then lastly, stuttering is different from disfluency, right? Everybody has disfluencies. Everybody has interjections, revisions, all those good things, right? But stuttering is a separate category. It's not just straight disfluencies. This is how Ed Contour, he was at the university, or he was at Vanderbilt for years and years, was an expert in stuttering, trained a lot of the great professionals today in our field. And he started out his textbook, the last edition of his textbook, with "I don't know what causes stuttering. I don't even know the best way to treat it." So we've got, this is a very much a individual disorder, both probably in cause, possibly, and most definitely in treatment. Stuttering involves the disruption in the forward flow of speech, differing in quantity and or quality from the typical speaker. So usually people who stutter are going to have more disfluencies, but most importantly, they're going to have a different type of disfluencies as the typical speaker. Speaker who stutter can experience tension, struggle, and loss of control while talking. So often people who stutter, again, there's more tension, there's more effort, more struggle. Sometimes people will say that, sometimes you'll hear parents say that their kids, even in therapy, are still having a lot of stuttering and they're not trying hard enough, but often people who stutter are trying too hard to talk. And that's often if they try a little bit less hard, an easier stuttering or more fluency is going to be the result. Stuttering may lead to feelings of embarrassment, anxiety, and fear of speaking, as well as attempts to escape and avoid stuttering and speaking altogether. So there are attitudes and feelings involved, as well as resulting behaviors and thoughts involved with stuttering. So, right, it's a lot more than, if we look at that, then, right, there's a lot more to stuttering than just the disfluencies or the types of disfluencies. We've got attitudes, we've got feelings, we've got behaviors, all wrapped up into one, right? So now let's talk about stuttering-like disfluencies. These used to be called maybe the core behaviors of stuttering or the basic behaviors of stuttering. But so we've got three stuttering-like disfluencies, and they're called stuttering-like disfluencies because these are the disfluencies most like the disfluencies of people who stutter, right? So we had our typical disfluencies that everybody has. People who stutter have those as well, but these are going to be the disfluencies that are going to be most like those that people who stutter have. So number one was short segment repetitions, right? Remember we talked about how, big, long phrased repetitions are going to be pretty typical of typical speakers. Short segment repetitions are going to be typical of people who stutter, right? So a sound repetition, right? Kick, 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 kick. Can I have some ice cream? Right? I'm repeating that sound. You can have a syllable repetition, and often a single syllable word repetition. So I want to go outside, right? We're having a moment of stuttering on just that, short, easy, single syllable word repetition. Second kind, we got prolongations, and this is when sound or airflow continues, but movement of the articulators is stopped, right? So really we're just prolonging a sound, right? So I'm doing that, right? You could hear the sound, I'm breathing, there's airflow, right? But if I'm going, right, my tongue is kind of jammed up against my teeth. It's not moving. I'm not moving forward. Finally, we've got blocks. And blocks are really where the person is, their vocal folds are in the closed position and they at least feel like they're not able to open their vocal folds. So, and that would be a laryngeal block, right, where I'm talking, but my vocal folds are closed, right? I'm not breathing. I'm not really making sound. Sometimes you can hear like the sound of struggle, right? But I'm not making the sound of that word or the first sound of the word. So that's a laryngeal block. And then an articulatory block is if I was stuttering on the word talking, right? Talking, I've got my tongue is stuck up the roof of my mouth. And so again, I don't have sound and I don't have airflow. Usually when you have an articulatory block, usually your vocal folds will close as well. So usually you have an articulatory and a laryngeal block at the same time. All right, so those are the stuttering-like disfluencies or the core behaviors or the basic behaviors. Now we've got the secondary behaviors, and these are reactions to the core behaviors. These are attempts to end stuttering quickly or to avoid the stuttering altogether. They're going to begin as random struggle but turn into well-learned patterns, and I'll talk about those and what I mean by that in a second. And secondary behaviors are divided into two classes. We've got escape behaviors and avoidance behaviors. So let's talk about each of those. Okay. Escape behaviors occur when the speaker is stuttering and attempts to terminate the stutter and finish the word. Examples could be eye blinks or head nods, or it could be something like interjections, and they're often rewarded because the stuttering ends afterward. Okay, so what do we mean here? So, right, I am stuttering and then I'm going to do something to get out of the stutter, right? So if I'm talking, right, if we have a 3-year-old who's asking mom for, what's for lunch and what he wants for lunch, and it's, mom, can I have a grilled cheese sandwich, right? Maybe to get out of that struggle of the can, right, to get that word out, maybe he blinks his eyes really hard, or does a head nod or a foot stomp, right? He takes all that pressure, all that tension that's up in his throat and mouth on the can, and he tries to disperse it by, doing something else. So, or it can be by doing the same thing just with an interjection. So, Mom, can I have a, right? So I'm stuck, I'm stuck, I'm stuck. And then I go, right? And that sort of releases everything. And then I'm able to get the word out, right? So this is rewarded because the stuttering ends afterward, right? Whether it's an eye blink, a head nod, something physical, or something verbal or vocal, like an interjection, right? That child, and 3-year-olds are amazing. They can hear something once or they can do something once, and they immediately learn it. So that child then learns that, oh, I do, I blink my eyes really hard, or stomp my foot, or I put it in and the stuttering goes away. So right, then they've learned to do this extra behavior. So not only do we have stuttering, but the stuttering is going to be accompanied by an escape behavior. All right, we've also got avoidance behaviors. And avoidance behaviors occur prior to the moment of stuttering in an attempt to totally prevent its occurrence. So, even before we've had stuttering, we're going to try to do something to prevent it from happening. Examples can be postponements, where I might just wait. And this is something I would do a lot as a teenager. I would pretend to be thinking. I might kind of, like, that's a good question. But really, I was waiting for that feeling of tension to subside, or I was thinking of, words I could change in my sentence in order to get it out fluently. We've also got starters, where somebody would use a sort of a stereotypical way of getting started. So you might start everything with So, what time is it? I think I'm going to go outside. How you doing today? So I'm going to throw in an or some way to get my voice going so I can then sort of ease into the word that I really want to say. A timer is really the same thing, where I'm going to, with a starter, I'm going to use or something, anything verbal or vocal to get started. With a timer, I'm going to do something physical. So I might tap my foot, I might touch my hair, I might, do some kind of movement to try to release some of that tension as a way to move forward and start talking. And then the ever popular word changing, where people who stutter will, or I'm going to stutter on that word, I'm going to substitute something similar. Again, in many cases, it prevents stuttering from ever happening, right? So really the difference between an avoidance behavior and escape behavior is really in the timing. An escape behavior, I've already started to stutter and I do something to escape out of it. In an avoidance behavior, I haven't stuttered yet, and I do something to get out of that moment of stuttering. So these are also going to be strongly rewarded. So I learn to say before I talk, or I learn to pretend I'm thinking, or you learn to change words, and they become very hard to remove. So now you've got stuttering, plus you've got this sort of behavior of postponing, or this need to word change. And it just makes the stuttering more complicated. There's it's getting older now, but there's a great article on BuzzFeed so if you just maybe type in Google things all people who stutter will understand on BuzzFeed, it has good examples of avoidance behaviors on there.